gridiron junkies make their way to the Fountain City, Uptown Columbus has become the new landmark for star-studded entertainment. And the Columbus Fire and EMS Department is giving Smokey the Bear a run for his money. These are some of our top stories on today's edition of CCGTV Newswatch.
Providing information covering events, activities, and news from Columbus Consolidated Government, you're watching CCGTV Newswatch.
From the Government Center Tower, this is CCGTV Newswatch. I'm Francine Foster. Before we start this week's broadcast, I'd like to dedicate this show to retired Colonel Robert Nett, who recently passed away. Colonel Nett was a U.S. Army veteran of World War II and the recipient of the Congressional Medal of Honor for Extreme Heroism in December of 1944. While still a junior at Hill House High School in New Haven, Connecticut, he enlisted as a private in the Connecticut National Guard. Colonel Nett later commanded the Infantry Officer Candidate School at Fort Benning, retiring after 33 years of active service. He then served for 17 years as a public school teacher in Columbus, Georgia, earning the system's Outstanding Teacher of the Year award 3 times. For over 2 decades, he assisted local veterans and the VA with benefit claims. Today, we honor him for his faithful service and wonderful leadership. Colonel Nett, you will be forever remembered in the hearts and minds of the city of Columbus. October is Fire Prevention Month, a time when we're reminded how important it is to have working smoke detectors in our homes. Unfortunately, many Americans overlook the simple task of changing the battery in their home smoke detectors, an oversight that can cost your family dearly. According to firesafety.gov, most home fire-related deaths are a result of smoke inhalation and not actual burns. The site also says 43% of home fires occur in homes where there is no working smoke detectors. So remember, taking the time to ensure your home smoke detectors are working could mean the difference between life and death. Meanwhile, in celebration of Fire Prevention Month, the Columbus Fire and EMS Department has found a way to get children excited about fire safety. We spoke with Lieutenant Michelle Jackson of the Columbus Fire Department to get a better look at how she's teaching some of our smallest citizens how they too can save a life.
We try to encourage them to help their parents or remind their parents to change the battery and test this smoke detector. And this year, on November the 2nd, it's going to be daylight saving time. They were going to change the clock back to standard time, and we want them to change the battery in their smoke detector and test them and make sure that a smoke detector on every level of their home, upstairs, downstairs, and basement, and also practice and plan for evacuation, having 2 ways. But we do it every year, at least for 13 years, the puppet show. The Medical Society Alliance, they volunteers, they come in and help, and they're the one that got the program started, and we've been working on the program for 13 years.
They're simple skills, and if they just have the opportunity to learn them at an early age and practice them every year, then they're life-saving skills. And we have had children who have saved not only themselves, but their families. In the last 13 years that we've been doing this program, we've had reports of children come back and say, you know, my house caught on fire, my Christmas tree caught on fire, and I saw it, and I was able to go and tell my family to get out of the house.
This program and trying to teach the kids that it is the best defense that you can have against fire if you change the battery in your smoke detector and carbon monoxide detectors. It's only take a moment, but it's the best defense you can have against fire and carbon monoxide poisoning.
This year's election has been abuzz with major issues ranging from the economy to education. But for many of our baby boomers, health care has been the primary concern of this year. Here in Columbus, residents can rest easy knowing there are people working hard to help area seniors care for their health care needs. The Area Agency on Aging specializes in assisting senior citizens improve their quality of life. Georgia Cares Coordinator Shamika Biggs stopped by our studios to tell us a little more about an upcoming program they're offering.
On November 7th, we are having open enrollment for Medicare Part D, and at that time, you can either get out of your Advantage plan, a Medicare Advantage plan, if you are in one. You can go back to original Medicare, or you can switch between Medicare Part D prescription drug plans at that time. Open enrollment is from November 15th through December 31st. On November 7th, I will be at the Columbus Library off of Macon Road. And you can come out there between 9 a.m. and 2 p.m. and I will be there to help you select a Medicare Part D prescription drug plan, help you get back into original Medicare if you're in a Medicare Advantage plan, or I can help you switch in between plans if you want to change plans for the upcoming year beginning January 1, 2009. Medicare Part D was established back in January of 2006, and basically it came out where Medicare wanted to offer their beneficiaries a way to pay for their prescription drugs, and it actually saved Medicare beneficiaries thousands upon thousands of dollars once they implemented this program. And Medicare Part D is just an addition to Medicare Part A and B. It'll be great for seniors around the city because if in fact you are in a plan that you don't want to be in, if in fact your particular drug plan's formulary has changed, your prescriptions have changed, they're more expensive, and you kind of want to see what other plans are out there, this would be a great time for seniors to examine their plans and look and see how they can save for the upcoming year. So it's a good idea for seniors who are Medicare beneficiaries and who have a Part D prescription drug plan or who don't have one. This is a good time for them to come and either change their plan, switch between plans, or go back to original Medicare if they're in an Advantage plan. And our number is 1-800-669-8387. That's our 800 number. Or if they want to call a local number, they can call 706-256-2917 and ask for the Georgia Cares Coordinator, which is me, and my name is Shamika Biggs.
What do Suzanne Swan, Peggy Jenkins, and A Deeper Shade of Soul have in common? We'll have the answer for you when we come back. But for all of you first-time trick-or-treaters, have I got a treat for your parents? Local resident and dentist Dr. Henry Cook is in the studio with us to let us know what to expect after the costumes come off and the candies consumed. Nikki Foreman standing by to get all the dental details. This is CCGTV Newswatch.
Hello Columbus, Nikki Foreman here to give you some more quick tips, but I'm going to do things a little bit differently. With Halloween coming up, I thought it would be nice to have a doctor in the studio to give us some dental tips. And with us today we have Dr. Henry Cook. How are you doing today?
Just fine.
Okay, Dr. Cook, let's just get right into it. What are some things that parents should be aware of with dental hygiene, their children, and Halloween?
Well, the biggest thing that we want to be on is just due diligence in brushing. I'm not so much about don't eat candy because those that will eat candy will and those that won't, they just won't. So the thing of it is just do more brushing, especially at night before you go to bed. And if you want to brush in the middle of the day, hey, that's fine also. And if you want to floss, that's just, even great. But the thing of it is brush at night, especially before you go to bed. When you're out eating candy all night, just come home and brush before you go to bed.
All right, as a dentist, are there some things that you suggest other than candy that parents should give out on Halloween?
Sure, there are often alternative candies that we can give. The thing of it is, are the children going to eat it? But you can always give apples, there's always carrots, there's always sugarless gum that you can give. So there are alternatives that you can have for the candies.
All right, so for people who are going to stay in the Halloween tradition, what are some of the worst candies that can be consumed by children?
Probably the ones that are very sticky, like the Laffy Taffies. Sometimes if you have the candy apples, they have the real sticky coating. So the ones that are real sticky are the Now and Laters, the Laffy Taffies, the Jolly Ranchers, things of that nature are probably the most detrimental to the teeth.
Well, there you have it, Columbus, straight from the dentist's mouth. So on Halloween, make sure you take in those tips and put them to use. For CCGTV Newswatch, I'm Nikki Foreman.
Good nutrition can lead to great things. Find out how a healthy lifestyle can help your child succeed.
Welcome back. I'm Francine Foster, and you're watching CCGTV Newswatch. If you haven't heard already, Uptown Columbus has been overtaken